Senate Majority Leader Reid this hour is expected to be meeting with fellow Democrats behind closed doors to tell them more about his proposal to overhaul our health care system in this country. This new plan on the Senate side does include a government-run insurance plan, but states would be allowed to opt out of it. That is the compromise that Senate Democrats made as they merged these two bills on their side into one. Senator Reid says he plans to take the bill to the floor within a few weeks for a vote, but he doesn't have the 60 votes right now. Let's bring in Bonjean, former communications director to Speaker Dennis Hastert. Pete Harvich is here too, former health care advisor to Senator John Edwards, and worked on Medicare and Medicaid at Health and Human Services during the Clinton administration. Peter, I want to start with you. How does he get these 60 votes, and why would he unveil it when he doesn't have them?
He's moving forward. He's doing everything he needs to do as majority leader to present his ideas, to bring people together, and he's going to be working with the caucus to get the 60 votes that are needed to get health reform. Everyone knows how important this is, and we're going to have a health reform bill.
But Peter, I'm going to stay with you for a second because you know the ways of the Hill. When he works with the caucus, what does that mean? What is going to be the compromise here?
The compromise is going to be working through some of the details, trying to develop a whole health reform package that he can build the 60 votes that he needs for. There are lots of different issues in health reform, and he's going to be working on all those, including the public option.
Ron, the opposition, I feel like we've said this before, so it's a bit of deja vu, but what may be bipartisan about what we're looking at here may be the opposition. As we've reported here, our Trish Turner on Capitol Hill, our producer, has said at about 5 o'clock this afternoon, moderate Democrats who have serious concerns about this plan will be meeting, figuring out what to do, and they've lost the one Republican they had, Olympia Snowe. So where is this going?
Yeah, this is going to be a terrible Tuesday for Senator Reid, and frankly a terrible week for him. He essentially tossed Republican Senator Olympia Snowe off the health care ship. He has placed his Senate Democrat moderates, at risk by daring them to support this bill with the public option, even though that they have expressed reservations. Even this morning, Senator Blanche Lincoln has expressed reluctance. Senator Snowe has said that she can't support it right now. And what this really is Senator Reid is caving into special interests in Nevada, even though the majority of people in Nevada oppose the public option. It's quite fascinating, the politics he's playing. He's rolling the dice, he's putting it all in, and at the end of the day, he's actually fracturing his caucus rather than unifying them. Frankly, I've been reading that he hasn't even told before he made the announcement, he never told his Senate Democrat moderate colleagues what he was going to do. That's why he was a party of one yesterday, standing there all alone making this announcement.
Peter, I'm going to read a quote to you from a House Republican that I read to Senator Casey just a few minutes ago. He said, Democrats in the Senate have emerged with the very vision that was shouted down at hundreds of town halls. I mean, I said this was a case of deja vu. We have talked about this before. There was significant opposition to it and anger over it. How did we end up back here?
It's actually not the case. This is what was proposed at the town halls. What you heard at the town halls were a minority of people who had some bad information and who were railing against health reform at all and the public option at all. The public option is about choice, and it's about giving individuals a choice between the private insurance they have or the public insurance that they could have. And now what we see from Senator Reid is some real leadership where he's saying he's going to give states choice as well. If states want to opt out, they can absolutely do that. And this isn't what the other speaker said. This is him caving into special interests. Special interests on the left want a full public option. This isn't their plan.
Ron, interesting though, in recent polls we have seen Americans say, I would be okay with government-run health insurance. What I'm not okay is what I'm seeing at the moment. There is potential support out there for it.
Well, first I would say if Senate Democrat moderates had an option, the option would be to press the reset button and start over. This is not what they thought they were getting out of the Senate Finance Committee when they had Olympia Snowe. That was, frankly, the best of the worst they could do. Now it's only gone downhill. Most people don't realize what a public option is. That's why Nancy Pelosi wants to change the term. It's pretty interesting, the semantics here. But when you boil it right down to it, all this bill is going to do is slash benefits, raise your taxes, take seniors and cut their Medicare, and it's going to be tough for the Obama administration, for Democrats, especially the moderates, to explain to folks back home during the town hall meetings over the Christmas break and into January what they did if it passes.
Ron, Peter, I'm going to have to leave it there. Thank